Thousands of people flock to Gauteng's hospitals for treatment daily, but others are often subjected to unintended harm at these facilities. The latest serious adverse events attest to this.
Between the time of 23-24, which is our last financial year, it was 7,117, but I also need to make you aware that the SAEs are also divided. You've got the SAEs, which means your serious adverse events that are pertaining to serious harm that could have happened. We call those SAC 1s. And you've got SAC 2s that there are events that had happened, but there are minor injuries there.
There's a lot of tragedy behind this. You know, if you're the victim of medical negligence, which is a large part of what a serious adverse event is, then you could lose a limb, you could suffer in pain, or you could even die. So that's the tragedy of our Gauteng hospitals. And
Gauteng's academic hospitals recorded the highest adverse events. The Steve Biko Academic Hospital in Pretoria recorded 552 incidents, and Charlotte Maxeke in Johannesburg recorded 447. 452 cases were reported at the Vescoppies Psychiatric Hospital in Pretoria. Helen Joseph in Johannesburg recorded 153 cases. Out of the tertiary hospitals, Tembisa recorded the highest numbers at 437, followed by Kalafong Hospital with 307 cases. The Chris Hani Baragwanath Hospital recorded the highest SAEs in Gauteng.
We've got our Para at 1,169, and we've got Dr. George Mukari at 619. They're central hospitals. Both of them are central hospitals, which means that they are seeing different types of conditions that are not being seen in other areas because of referrals, and their complexities and complications that are being seen there, and the numbers, of course, of the patients that are seen there.
We need to look at factors that are out of control of staff, if there's a lack of equipment or inadequate staff, something like that. But there is a human factor involved, and I'm afraid that too many medical staff are not doing their jobs to save the lives of patients and alleviate their suffering. This is a department where corruption is rampant, and we saw Babita Diakaran was assassinated because she tried to stop the massive corruption at the Tembisa Hospital. The SIU figure for what's been misspent at Tembisa Hospital is 3 billion rand.
Various corrective measures are taken.
Corrective measures, they are not only meaning that people must be disciplined at all the times. At times you may find that it was an error. Then a corrective measure of an error is for you to train and try and explain to the person as what went wrong, because remember, also training institutions.
Let's just put the right people in the right jobs, efficient, honest people, and I think we could start to turn around the problems of this department. Look, the rot is very deep-rooted.
Gauteng's growing population and the influx from SADC also adds to the high SAEs in the provincial hospitals.
We're seeing quite a large volume of people coming to access services within Gauteng, given that we are the largest healthcare system in Southern Africa, but there are also other structural factors that you find within the system where we need to obviously improve the issue of infrastructure, expand our infrastructure. We need to also ensure that there's continuous training in terms of the various protocols that we have to follow, so that we are on par with developments in the world around treatment of patients and so forth. We also have people from SADC region that are, because they are closer to us, they from time to time come through to access services, or when they're here.
The solution to treating foreign patients is to have a treaty with our neighbouring countries. We used to have payments from other countries in the past, so we need to reinstate it, but we need to actually document it properly, so that if we are treating a patient from a neighbouring country, we can send an accurate account.
Meanwhile, the Gauteng Health Department is adamant that despite the thousands of serious adverse events recorded annually, the province remains committed to improving services rendered by strengthening and enhancing safety aspects. The department has also improved its monitoring and turnaround time in resolving complaints lodged. Patricia Fasaki, SABC News in Pretoria.